Wonderful. It sounds like you can all hear me, so I'm going to go ahead and get going. I'm Kim Spence, and I work for the Center for Autism and Related Disabilities at the University of Central Florida. And I'm going to talk to you today about supporting individuals with autism spectrum disorders in learning about sexuality and socially related issues to sexuality. I would ask as we get started today, if you have any questions, if you could please write them down. And at the end of the presentation, I'm going to allow for 15 minutes, or if I need to stay online longer, for you to go ahead and ask questions about the content. But in order for me to move through the content in the most expedient fashion, I would very much appreciate if you can hold your questions until I open it up until the end. And that would help me to stay on track and to help you all get all the information that you can today. We have a very quick amount of time, so I want to get to as much as we can and be sure that I give you all the information I can to help you. I want to also be sure that you understand that in this presentation there is going to be graphic material. Now, the intention today is to talk to you very specifically about how to intervene and how to develop specific tools and supports for people who have autism spectrum disorders. I'm going to touch on a bunch of different things, and I'm going to cover a variety of topics, but I want you to know that I'm going to be very specific. I'm going to talk about genitalia and use words like penis and vagina and things of that nature. I am also going to show some images based on materials I have made and things that I have seen in the past. I don't do this for the shock value or to be upsetting to anybody. I want to be clear about the content and what we're here to talk about. I know that for many people this is an uncomfortable topic, and I hope today we'll have a little bit of fun and you'll get to learn something about how to help support your child or your student or somebody that your agency may be supporting. So all of the slides I have provided, and I want you to know you should have in this presentation, but please know my contact information is at the end, and if you need anything else, you can please contact me. I am likely going to talk about things that are uncomfortable and you may not agree with today. I'm going to share with you my experience in working for the center. I've been with the center for almost 17 years, and I've been in the field for 25 years. And for most of that time, I have been supporting people with more significant disabilities and teaching them about sexuality education and helping their families. So I know we all come from a different place, and I know that we may not all share the same viewpoint. I hope you will kind of come along for the ride and hear what I have to say today. If it becomes too much or it becomes offensive to you, please feel free to tune out. It will not hurt my feelings. I completely understand everybody has different thresholds. So without further ado, here are some of the rules that we are going to follow today. I'm going to try my best to use technically appropriate language and to share with you about some of these things using scientific language. I hope that won't upset anybody. Please know that our comments are all viewable by the people who are signed in. So I ask that we keep it respectful, even if you disagree with something I am saying or something one of your fellow participants may type by way of a question. We'll agree to disagree today if we don't see eye to eye on some things, and I hope that will be okay for all of you. And please remember, if you have a question, please ask the question. Know that if you have the question, I guarantee you somebody else has the question, and there are absolutely no stupid questions. So please feel free at the end of the presentation today to ask about anything, either in the content of the material or that I've talked about. I want you to know up front that my bias in supporting people on the spectrum is that they have a right to have relationships. They should be included in their community, and I want for every person that I work with to have the right to choose a romantic partner or who they want to be involved with in a safe and in the most appropriate manner that we can. I want you to know that my background specifically includes training law enforcement. I've been training law enforcement for the last 16 years, and I train them all over the United States. I've also been training about sexuality education for the entire time I've been at CARD, and that's been for 17 years. And unfortunately, I see this intersect between sexuality and people who become embroiled with law enforcement. And it's why it's very important to me that we teach young people, especially good social skills as they relate to sexuality and social boundaries. So I'm going to work really hard today to cover that, but please know my very strong support and my strong belief is that everyone should be included and everyone should have a right to have a relationship. So I want to speak pretty specifically today about, I don't know if you're tuning in and you have a school-age child, or you're tuning in and you have an adult, or you work with an adult, but here's some things I want to try to touch on throughout the presentation. If there are persistent issues that have caused you to tune into this webinar today, they should be included on an IEP or on a functional behavioral plan or on some kind of treatment plan if that individual is having persistent problems related to sexually inappropriate behavior, including touching, including getting in people's boundaries, including saying things that could be perceived as inappropriate or sexual in nature and unwanted from a receiving person. If there is a safety issue, we should always be talking about it, and we should always be very intently focused on rendering treatment and coming up with evidence-based, effective intervention strategies to work for that person. Let's please remember that if we want an individual's behavior to change, the first thing that will have to change will be our behavior. I know, unfortunately, things that involve sexuality sometimes are very uncomfortable for us as parents, as providers, as people who are working in the community. But no, if the individual is doing something that they should not be doing, they're not aware of, they don't perceive as inappropriate, we are going to have to change our behavior first. And I'm going to talk a lot about that in the next 40 minutes to help you understand what I'm specifically referring to. But we need to make sure that folks have the skills to stay safe and to do the things that they want to do in the community in a safe way, whether that's relationships or otherwise. So I'm going to tell you some things very quickly that I know that do not work. And first and foremost, that would be pretending that a behavior is not happening. For example, if somebody is sticking their hand down their pants, if somebody is saying something inappropriately. One of the young men in one of my groups just last week was telling the waitress that she had beautiful boobies, which maybe she does have beautiful boobies, but that's not an appropriate thing to say in the community to somebody that you don't know. So a lot of times we get embarrassed and we want to kind of stick our head in the sand and pretend like it's not happening. And I don't advise that because it's not going to change the behavior of the individual, and it's not going to teach them what they need to know about what they should be doing that's appropriate. I know it may feel more comfortable for us to kind of la 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 and pretend it's not happening, but that doesn't help the individual understand what they're doing that's not correct. Sometimes we overreact. Oh my gosh, you better stop that right now. Again, that is not teaching the individual specifically what they need to know about what they're doing that's inappropriate or ineffective or could be potentially dangerous or illegal. And we have teacher stink eye, or sometimes I refer to this as parent stink eye. And this is when somebody engages in a behavior that is inappropriate and we don't want them to do it. And we do this a lot with neurotypical people, and we kind of give them the stink eye, and we expect that they're going to know what they're doing wrong. And this is not effective for people who have autism spectrum disorders because their brain does not process information that way, which most of us are already aware of. Unfortunately, most of us neurotypicals do this on a pretty regular basis, and we have to be very explicit in what it is we're talking about to an individual. For example, you cannot put your hands in the breast region of somebody you don't know. You should not say to a waitress, "You have nice boobies," if you've never met her. We have to tell them directly and explicitly what it is they may be doing or saying that may be inappropriate to help them understand. This is not us being mean. A lot of people say that to me, "Oh, Kim, that sounds like you're being so mean." This is not being mean. This is intervention. And this is an attempt to teach people adequate life skills so they're prepared. Unfortunately, in the world of special education, a lot of us, and I was guilty of this for a long period of my career, we've kind of kept people in a bubble, people who have disabling conditions, and they've been a little bit overprotected in some incidences, and they have not learned adequate skills to interact with others or to know things about sexuality that they should. So we should keep this in mind, especially if somebody's been in a self-contained classroom, or they've been in a private setting, or they've been homeschooled. They may know even less information, and I'll talk a little bit more about that moving forward. So, some things that we know are not true about people who have disabilities, who we teach sexuality to or information about. And when I start to talk about this to teachers or people in the community or providers, it's very clear in to people that our folks know a little bit less than everybody else. We know this based on the scientific literature, but there's a belief system that still seems to be prevalent, indicating that people think, well, if I teach him about this, he's going to start wanting to have sex all the time or masturbating all the time, and that is certainly not true. Teaching people about appropriate behavior makes them safer, gives them a better knowledge base, and helps relieve any kind of situation that may be happening in the community that's inappropriate. We have no evidence, we have no research, and I can tell you after doing this for 25 years, when we do intervention, it doesn't make people become sex-crazed maniacs who are going to start taking out people on the street. That's not how that happens. Again, it promotes better behavior and often promotes helping people to develop relationships that they may not have otherwise had. Let's please keep in mind that not everybody we work with prefers the opposite sex. And regardless of your views about homosexuality, people who are gay, lesbian, transgendered, or otherwise, please keep in mind that in the population of people who have autism spectrum disorders, we see the same kinds of prevalence rates that we do in the neurotypical population. So let's not ever assume that everybody is attracted to the opposite sex or vice versa. Let's always make sure we're getting good information. So I want to talk a little bit about the research, and I want to do this very briefly in the interest of time, but I want to help you understand that we don't have a lot of good information that tells us how to provide sexuality education to people who have disabling conditions. Sorry about that. What we know overall is that people with disabilities have less information about sexuality. We know there have been very few studies conducted on people with autism spectrum disorders in the community. There are a few studies that have been conducted in institutional settings. Unfortunately, most people are not in institutional settings, actually not unfortunately, but because the studies were conducted there, they don't always give us adequate information to help direct us about how to intervene with people who have autism, who may need better information to navigate their community and relationships. We know that having autism means your body does not develop any differently. You have the same feelings, the same physiological feelings. It's often more confusing. So know that it's the same, their desires and all those kinds of things, just as their neurotypical peers. So we have fewer studies. They tend to be qualitative in nature, not necessarily factually based in numbers. And we know that there is a really significant need for a review of how teachers are teaching, and in the literature, the population of people that are most uncomfortable with this kind of training are teachers. So I hope any of you watching today are teachers, and I applaud you for being on this webcast. We also know that the vernacular describing sexuality varies from curricula to curricula. There is no agreement on the use of a specific curricula that will teach every person with autism about sexuality. And for me, I always go back and look at the literature because I want to know what have we used and what empirically works for people with autism spectrum disorders. To date, we have no literature that suggests using a specific curricula, specific language, a specific amount of time works for every and any person with autism, which means we need to tailor make every intervention for all people out there. And I'm going to talk more about that. We know that people on the spectrum are at greater risk for abuse. We know they are at greater risk for becoming victims, and in some instances, victimizing others unintentionally. This is clear in forensic literature, and this is also clear in behavioral literature. So very important topic and a lot of important stuff to talk about. I just wanted to say again, we do not have evidence about specific efficacy, and we should always be interested in the efficacy of intervention. It's something I always look at. Evidence-based practice should be the norm. I can tell you, and I have this slide in here, that many years ago, I did try to teach young men with autism to protect themselves by wearing condoms. Myself and another intervention specialist worked very hard to teach them about STDs and about condom use. Unfortunately, I had guys that would come in and their girlfriend or their significant other would become pregnant. And the problem was we were teaching them to put a condom on a banana. And because they were so literal, they would be involved intimately with somebody, they would become aroused, they would get out of bed, they would run into the kitchen, they would put a condom on a banana, they would go back in the bedroom and have unprotected sex. This is why it's critically important to be very focused on all aspects of treatment to make sure we're using the best intervention, that we're making it clear to the individual what it is they need to know and they need to understand to keep them safe and to help them with whatever it is specifically they may need to know about maintaining a relationship or getting into a relationship. So all this is really super overwhelming, and I completely understand that, and I feel overwhelmed myself on many occasions. So what do we do about this? How are we supposed to deal with this? Well, we have to teach. At the end of the day, this is about good, solid intervention and good, solid, sometimes behavioral intervention. And what we know about working with people who have autism spectrum disorders, there is a whole group of methodologies that have been identified as effective. There are things we know very clearly for the last 60 years in our literature that tell us using direct instruction, using visual supports, using video modeling, using some of these tools works to teach information to people who have autism spectrum disorders. I have used many of these things along with my colleagues to help provide intervention to people, and I have found them to be very effective. I'm going to move very, very quickly over the next section and portion of the presentation just to give you an idea and the flavor of some of the kinds of supports that have been developed by our center and that we have used very effectively. So please know, I apologize, but I'm going to move quickly because I want to try to get to everything. All interventions should be very focused on the relevant, salient information the person needs to know, and everything should be age appropriate. We build things based on the person's age. If they are 9, if they are 12, if they are 19, if they are 22, I look at their neurotypical peers and I build supports that look age appropriate for them because I'm interested in their community-based inclusion. And that is very, very important. So we want to use social stories, which most of us are familiar with. I'm going to show you a quick example. And we want to use directed social skills training. I'm going to talk a little bit about bathrooms, and we want to teach to long-term routines and schedules, especially relating to hygiene, which is a huge issue for a lot of the people I work with. And we want to certainly move beyond the acquisition phase and learning. A lot of us are very good at developing a beautiful intervention. We use it one time, we work with the individual, and then we don't practice for actual acquisition of the skill, maintenance of the skill, and them generalizing that skill. And that is critically important. So we need to move beyond the acquisition phase in learning and in behavioral intervention to help get this information out there or to teach specifics. I want to just say with materials, I get calls all the time from all over the United States asking me what material, what's the best autism material? Friends, there isn't one. There's hundreds of different things available. We choose these based on the individual and what they may need specifically for intervention. Don't be afraid to use things, and the example I've shown here is for neurotypical kids. Don't be afraid to use those. I'm happy to send you, I have an annotated bibliography with all kinds of resources, and I'm happy to send that to you if you want to shoot me an email. But there are hundreds of commercially available products that are not directed for autism. And please beware, sometimes things that are called autism sexuality books are not very good. So just use caution. Also, don't be afraid to use things that are not specific for or to people who have spectrum-related disorders. So the first thing we look at for kids maybe coming into puberty is supporting them visually, preparing them for how their body might change. We can make these, we can pull things from online, a lot of commercially available products. My best bet is to prepare people for what they're going to expect physiologically. My body's going to feel different. My body's going to smell. I'm going to get hair in places I didn't already have hair. And for people who have really significant sensory sensitivity, especially young women when they begin their menstrual cycle, this can be a very challenging phase. For young women, I'm a huge fan of teaching them to use tampons. I know a lot of people will go, oh my gosh, how can you do that, and get kind of cringe about this. I promise you, teaching tampon use is very simple. Believe it or not, there are some excellent YouTube videos about how to correctly and safely insert tampons and visually how to orient people. And for people with sensory problems, I prefer tampon use to large maxi pads that sometimes becomes very weighted down, doesn't smell very well, and are a little more difficult to keep clean and manage for people who don't have good independent skills. For young men, we want to prepare them that they're going to get erections, that this is normal, that this is nothing for them to be afraid about, and for them what this means in terms of being appropriate in their classroom, if they're around other people. For example, I don't need to announce to other people that I have an erection or pull my pants down and show other people that I have an erection. And those are social skills specifically, but we need to prepare young people for what's going to happen to their body, how their body's going to be different, and what nocturnal emission, or what we refer to as a wet dream, is. And just want to say also to that, it can be very frightening for young men if no one's talked to them about this, or they don't have any idea what this is. So we want to deal with body, hair, smells, the onset of acne, and again, for people who are very sensory sensitive, I've had people who will dig and gouge to the point where they become infected. So we want to increase the hygiene related routine. And if medication is maybe something that might be helpful to help with acne or kids who dig or pick, that also might be recommended. I have young men I have worked with that have plucked out the hair around their genitalia, maybe during class, and they get into a bit of trouble. It's not socially appropriate. If you're working with somebody who has significant sensory problems, we probably want to address this issue of how to safely remove hair before they start getting a lot of hair. I had a family I went to do a visit with about a month ago, and their daughter had come into puberty, and she had quite a bit of pubic hair. And the mother walked in on her with she had taken the mom's big sewing, they're called cutting shears, and was trying to cut her pubic hair with that because it was uncomfortable. Fortunately, we were able to stop that and to teach her a better and more appropriate way to do that. But again, this is about prevention. This is about getting ahead of it and helping the individual to understand what's going to happen and what they can do that's appropriate. For people who may dig or pick, we would use a visual support to help orient them specifically about what to do or what not to do. There's lots of ways to use visual supports, and this is but one example that I've used with many kids in that phase of when they're coming into having acne, and these are commercially and available on the internet. So regarding health and hygiene, we want to teach people that being clean is critically important. I say to all my young men and women who want to have relationships with others, if you do not smell good, people do not want to date you. People do not want to talk to you. And that is not being mean, as I said earlier, that's being honest. And it is a social skill. Brushing your teeth, putting your deodorant on. Specifically, I need to help them understand that they are socially not going to fit in when they're not clean and they're unkept. And as we all know, this is a pretty typical thing that happens with people who are on the spectrum. So we want to try to prevent that. For people who are not embarrassed easily, which is a lot of young men I work with, we need to talk about modesty, when I need to be modest, things that I need to be modest about, specifically that they may need to keep in mind. And for young women, gynecological care. I'm going to come back to the restrooms because it's a very important topic. And in this group, I just want to say about eating. I spend a lot of time we run a lot of groups at our center, and we have 7 districts where we run them specifically. Myself and my partner spend a lot of time talking to people about how to eat in a socially appropriate way. I don't shove the whole thing in my mouth, and I don't take bites of other people's food. And you're thinking to yourself, why are you talking this in a sexuality presentation? I'm talking about it because if you're a young man or young woman who wants to date someone or have a friend and you eat in a disgusting way, people do not want to be around you. They do not want to talk to you. And that is the beginning level of trying to have a relationship. So if you have folks with trouble with that particular issue, definitely make some supports and address it. To keep clean, we make social stories, sometimes that look more childlike or more adult-like. We use digital images. Sometimes we use boards with Boardmaker overall to show them this is a sport I made for an 18-year-old that I'm working with to help him with his morning routine. Again, I'm trying to mechanize the routine. Most of us have a routine. We get up, we wash our face, we brush our teeth, we go through it in a certain way. There's a lot of ways to do this. So in this particular routine, what you'll see is the picture here. So he would engage in washing his face, and then he would turn this card over and put it on top of this, and he would take this check off and put it onto the counter. So he could go through this whole thing, and this would visually support him, and this has been a very effective tool for him. With intervention, he's about 6 weeks in, and he's almost completely independent doing this without any prompting. I know a lot of families ask me about, I need to help him brush his teeth, I need to help him take a shower. Visually supporting that, using those supports is one of the best ways I know. I also use a lot of video modeling to help support this as well. Keeping clean. This is an actual board that was made for a young man we were helping with hygiene, and we were teaching him to wash his penis correctly. If you'll notice down here on the image of the penis, this young man had an uncircumcised penis. We always need to be very detailed and careful that we are exactly depicting the individual and the most salient characteristics we need to convey to them. It's very important that these are all outlined specifically, because if I have autism and I show something pictorially that doesn't line up, they're not going to attend to the support, and we need to make sure that their understanding and the support is clear. I want to talk about restrooms here for just a moment. Restrooms are a very dangerous place. Restrooms account for a lot of the individuals that I work with who become involved with law enforcement. And I could tell you many, many stories of how the restroom has not worked out well for a lot of people that I work with. If you were tuned in and you were supporting a young man who is going into public restrooms, here's some things we need to keep in mind. A lot of young men who I work with do not understand that they are not supposed to socially engage with others in the men's restroom. Now, in the ladies' restroom, ladies, we know we value talking, we value hanging out and chatting each other up. In the men's restroom, this is not permissible behavior, this is unacceptable, and this could be certainly something that might involve a physical altercation. Additionally, I work with a lot of young men who will go in the restroom to use a urinal. They will pull their pants and their underwear all the way down to the floor. This is not acceptable. This will upset the other men in the restroom. I've seen a lot of problems related to this. It is a social rule in the men's restroom that you pull your penis either out of your pants or through the opening in your pants, but you are not allowed to show your bottom. And a lot of women do not know the rules in the men's restroom. It's important, ladies, that we know the rules so that we're teaching our sons, our students, or anybody who needs to understand these. Additionally, they need help with managing their clothes, sometimes managing things in the bathroom. So going back to making supports and talking it over with young people, we need to make sure they understand what the rules are, how to follow them, what they need to do or not do. I will say I've had a lot of issues with young men who go in the restroom and they want to use a stall, and they'll kind of peek between the cracks in the stall, or they'll get on the floor and they'll try to look up into the stall. Those behaviors are illegal, and when the police get involved, that doesn't go so well. So here's some actual supports I have made. I have used visual supports, I've used power cards, I've used video modeling, video self-modeling, and what's called video point of view modeling, which means you shoot video from the point of view of the individual to show them the behavior they need to be engaged in. Here are some additional things. I will keep my pants over my butt. I will keep my thoughts to myself. I've had guys get into altercations with others in the restroom because they commented on somebody passing gas or how smelly somebody's bowel movement or otherwise. That is not socially acceptable behavior in the men's restroom, and it often needs to be taught specifically. Here are a few others that I alluded to, and one of the others I just want to say, I had a young man recently in one of our groups. We were at a public place, and there was a group of motorcycle gang folks there. They were very nice. I love people with motorcycles. My friend with autism goes into the bathroom, and 5 minutes later he comes out of the bathroom following one of these gentlemen in the motorcycle gang, yelling, "You didn't wash your hands!" And myself and my partner, and maybe some of you have experienced this firsthand, where I have guys that are rigidly following the rules and they want to tell other people about that. And while we very much appreciated him alerting us that that gentleman had not washed his hands after handling his penis. That is not socially acceptable behavior, could lead to other problems. Thankfully for us, it did not involve any physical altercation, but I'm aware of many instances where that has involved physical altercations or law enforcement. So we need to help people understand the rules of the bathroom, what they need to do and how they need to act. And the best way I know is to review this, direct instruction, and the use of specific static supports. This is an excellent resource, Taking Care of Myself by Mary Roble. This is a $20 book. I love the way it's set up. It's very easy to use. It has all kinds of things about masturbation, boundaries, where I can be naked. It talks about topical areas. It gives kind of a targeted social story and then visual supports. Great book, highly recommended if you're interested in any of these topics we're talking about today. So with respect to boundaries and people interacting, it's very important that our young men understand the difference between public versus private and levels of relationships. Is a big problem for a lot of young men and women that I work with. They don't have an in between of friends, acquaintances, romantic relationships, and they often engage in behavior that is asynchronous with any of these specific relationships. And that can be troublesome. It can look creepy. It can come off as really bad. So we need to be very focused on that. Again, specific to age appropriate. Folks need to be engaging in age appropriate skills, and we need to be teaching them in an age appropriate manner. We need to be specific about good touch versus bad touch. And I say this because in our special ed bubble, we've often taught kids with autism that anybody can touch them or they can put their hands on anybody and it's okay and it's not okay. And we have to help them understand. By the age of 8 or 9, we start handshaking. We're not hugging anymore. We're not kissing. I went to see an adult 2 days ago, and when I went to meet him, he's 28. He pulled my hand in to give me a kiss. Now, yes, it's very sweet behavior. I'm not a known person to him. This is something he's doing in the community, and this is something you can get arrested for. This is not an appropriate social boundary, and we need to move past this part where we go, oh, that's all well and good. It's not appropriate, and it could come across as dangerous, and it could come across as threatening. So we need to practice with folks about specifics about boundaries, what's okay or not okay, using directed instruction. Role play is another really great way to do this. I'm going to show you some visual supports and some targeted scripts. This is a commercially available product from David Hinsberger's group. It's called the Circles program. This basically using these isometric circles helps people understand these are my close friends and family. They're allowed to see me naked. I'm allowed to see them naked. And in the next layer, these are people that I'm close to, but I'm not allowed to see them naked. They're not allowed to see me naked. I'm not allowed to talk about my medication change. I'm not allowed to talk about my erection, any of that. And we use to teach within these boundaries. I've seen this be used very effectively. Most Fiddler's resource libraries have this actual curricula. It's about an $800 curricula. I hope most of you are aware of the incredible 5-point scale. I use this a lot with sexuality and talking about how much I might like somebody, how aroused I might be, and these other kinds of things for identification purposes, to help parents, providers, or teachers understand, and to help the individual when I'm excited, when I like somebody, when I feel like I'm in love with somebody, where am I at on the scale, and what can I do? What am I allowed to do? What is appropriate behavior in lieu of and or in the face of that? So bringing it back around to some concerns I have about the legal system. I have great relationships with law enforcement agencies. I do a lot of training with them, and I also get a lot of calls from people who get arrested for doing things that they don't realize or understand that is illegal. So if you're working with somebody or your son or daughter is touching somebody inappropriately, that needs to be immediately dealt with. Behavior plan, intervention, immediate. If it looks dangerous, if it has the potential to become dangerous or look illegal, that means we need to immediately intervene. And a note about this, we need to be cognizant about cyber safety. I work with a lot of young people and have worked a lot with the UCF Police Department with young men who are cyber stalking, and they don't realize that they're sending 50 messages to their classmate is stalking, or that the content of the messages might be sexually inappropriate. This is actually a text message that I received from an adult that I work with, and I love him to death. I've worked with him for a very long time, and I want to just help to keep this in context. So he's talking about the Victoria's Secret fashion show. No big deal, and it's fine. I'm a known person. But if I'm a male and I send this to a female who is not a known person to me, a lot of us might read into that or have some thoughts or ideas about that. So please monitor the social media. Please have a talk with your individual about social media. Very dangerous. They need to understand in cyberspace, nothing ever goes away. Want to show you this is another text from my same friend, and this is what was actually on his Facebook. Now, he's not hitting on me. I want to be clear about that. He's very interested in Star Trek. This is a picture from Star Trek. A lot of my friends are very into Star Wars or Star Trek, and they'll take these kinds of pictures not for the sexuality of it or the sexual content of it, and they just want to share it. And again, if I'm not a known person or I don't know this individual, person might misunderstand this and might call the police and might say, hey, this weird guy is sending me stuff. So we need to address online rules. We need to address who you should be talking to, things you're allowed to say. This is a whole specific training we could talk about. Who's allowed to have access to your information? If somebody's asking you to send dick pics or to send you nude photos, what do you do? And if someone is soliciting an individual, which has happened, what do you do? Who do you alert? Who do you tell? If someone sends you an actual, because this gets very legally challenging, and if the individual downloads images and things like that, we need to be able to intervene with them. So make sure you're dealing with this or having that talk. One of the resources I really love, this is another very inexpensive resource called 5 is Against the Law. This is the same author of the incredible 5-point scale, and I love the breakdown. She uses the 5-point scale, and again, it's basically to help you understand this is sort of okay, this is a little creepy, this is challenging, this could be perceived as illegal, and you need to be very, very focused on that. So for any of you who are upset by very salacious images, you may want to turn away here just for a moment. I'm going to share something that was sent to me by a school, by a public school. The public school called me and said, Kim, one of our students is bringing in pornography and is showing the pornography to the other students, and this has been going on all week, and we're going to call the police. And I thought, oh my gosh, what's happening? I said, can you send me an image? Can you tell me what's, because I know what the federal definition of child pornography is. I know what the definition of pornography. I said, send me an image. Let me try to help you out before we go any further. This was a 17-year-old young woman with autism. This was the image they sent me. So for some of you, you may recognize this is a depiction from Japanese anime. And very frequently in Japanese anime, in adult-rated books, and on this book, on the cover of this book, it said 17 and older. You will see pictures of bathhouse scenes that are not sexual in orientation or nature. It is just something that is depicted with regularity. So the school got very upset about this. And the other problem with this was the young lady with autism, they would take it away from her, and they would say to her, Jane Doe, this is inappropriate, don't bring it back to school. And they would send it home to her dad, who, by the way, also has autism. And he would read the front of the book where it said 17 and up and hand it right back to her. This went on for 4 days until they were threatening to call the police, and they called me, and fortunately we were able to intervene. And so myself and the behavior analyst came up with, this is using PowerPoint, this is a visual support, saying you cannot bring sexually explicit materials to school, you cannot show them to minors, and here's all the things you're not allowed to show in depictions. And this is a very clear list, which I'm going to keep moving in the interest of time, but just to give you an idea of what I'm talking about, we have to be clear when we're saying to people, you're doing something that's inappropriate, you're doing something that's not working, whatever you're saying to them, we need to move beyond that language and make it clear for them so they understand what it is they can and cannot do and what's legal or illegal depending on the situation that may be happening. So I want to talk briefly about targeted scripts. So we teach and we do a lot of work with people who are trying to make a friend or trying to meet someone or trying to begin a relationship. And so the first thing we do is teach you need to look at the person, you need to try to engage in eye contact. There's a lot of ways to practice that. The next thing, and we really harp on this, make sure the person is attentive, appears attentive, and we break that down. We model it, we show it on video, we model them, we show them examples and non-examples. And when I'm using a targeted script, I'm going for automaticity. Okay, and I want you to think about when police go to a firing range and they practice shooting their guns. So in the moment of stress, they do it automatically. And targeted scripts are designed to do the same thing. I'm going to practice with someone over and over and over again so that when they're in the moment, this is the script they're going to say. So this is the actual thing we teach a young person to say. Hi, fill in the name, wait for the pair response, meaning hi, whatever, wait. And then I practice smiling, and not creepy, scary smiling, but smiling. And then we talk about a desired topic. So I specifically teach to this. This is another one. A lot of my guys in the community will see someone who's attractive. They will walk right up to them and say, please give me your number. What are your, they go right into it. So we have to talk a lot about, you need to talk to somebody for at least 15 minutes. Make sure they are receptive, and we give examples and we show non-examples. This is not receptive, because I have guys that will yell across the room or talk over people, and we have to make that really clear for them and practice that. Okay, I can't just say that. I have to practice that. I have to role model that. I have to make sure. And we want to practice very, very clearly, my friends, and please hear me on this. You need to practice for the epic fail, okay? A lot of my guys have not been told no very often. A lot of my guys, people kind of go, okay, and they go along with it. They're not generally prepared for people saying no or get away from me, and I've seen guys have a total meltdown. And while I can understand getting shot down is not comfortable, and I get that, I totally understand that, we need to practice for that. When someone says no, what can I do? When someone is not receptive to me, what are appropriate behaviors I can engage in? I think this is a life skill. And again, I want to just say, we have to help them understand that not everybody's going to want to go out with them. And it's not the end of the world if somebody doesn't want to go out with them. And it needs to be taught very specifically. So this is an actual script that we teach to our gentlemen and our ladies. So when someone isn't receptive, what that means, what that looks like, and what do you do about that? What am I supposed to do when somebody's not receptive? Smiling, thanks anyway, and help them. A lot of my friends already look unusual. It is very important to me to help them try to look as normal as possible. Okay, well, you're not interested? No problem, walk away. Practice the smiling. It was nice to talk to you anyway, and walking away. I want to reduce the creepy factor. We need to reduce the scary factor. And I do not say any of that to be inflammatory. I'm speaking the truth, and I've done this hundreds of times. Important to show them and make sure they understand this, and they're able to very specifically know what they need to do and how they need to do it. So last, we are going to talk about masturbation for the last 5 minutes today. And again, there's a lot more information about this, and I'm going to try to be as succinct as I can. So a lot of people will refer to masturbation as punching the clown. It's a euphemism. I don't know if any of you have heard that. My police friends share that with me. So people ask me a lot about should people be allowed to masturbate in school? Absolutely not. Absolutely not. We need to be working on academics. We need to be working on communication. We need to be working on targeted social skills. Masturbation is for at home in your room. I have gone into many schools to do an observation of a young man or a young woman and walked in and the person has been in the bathroom. This is dangerous, my friends. Okay? Teaching people to masturbate in the bathroom is dangerous. It is not a good idea, and I can tell you after 22 and people exit into life, I have many friends with autism who are sitting in federal prison because they masturbated in public. And the laws call that something different, and we need to be very cognizant of that. Social mores and dictates tell us you can masturbate in private. please do not teach masturbating in the bathroom. There are other things at school we need to be working on. That being said, if someone is trying to masturbate at school, if someone is touching themselves inappropriate at school, that can begin a whole dialogue with the family and an intervention team. What do we do? How do we help the person understand what's appropriate or what's not appropriate, when they're allowed to, when they're not, and we specifically begin to deal with it. So sometimes it's helpful for us for somebody to demonstrate these skills. Don't be afraid. I know it's uncomfortable. There are a lot of people who can be called in to be supportive, but we need to focus on maximizing programming for the individual, not masturbating at school, teaching them specific social skills that are acceptable and appropriate based on age, based on the setting that they're in. For me personally, for CARD, for agencies and schools, we want to work collaboratively. We want to work together. We do not all have agreeing viewpoints about masturbation, and I completely understand that and I respect that. There are times on an intervention team where people look at me and they're beet red and they're horrified and they tell me, Kim, I just can't do this. That's okay. It's okay if you're not comfortable. It's okay if you don't want to talk about this topic, but we need to get somebody else on the intervention team who can. How do we talk about masturbation? How do we help teach the individual to masturbate if that's what needs to happen? And it's very individually based on the individual, on their familial units, and on the support system around them. And we have to look at all of that for good prescriptive intervention. We need to be respectful and we need to be collaborative. This is not a one-man or one-woman sport, nor should it be taken on that way. We need to be specific in the materials that we make, that they are relevant, they are distinct to the individual, that they show explicitly and saliently what we need the individual to understand. And there are a whole bunch of ways to do that. And I'm sorry we don't have the time to go into all that. And so a lot of you might be thinking, okay, that sounds great. Well, where do I begin? You know, if my son or daughter is showing and expressing an interest in masturbating or they're touching themselves, what do I do? Where do I start? Well, the first place I start is public versus private. They need to understand that my public behavior and my private behavior are different. Hundreds of ways to do that. My at-home behavior, my at-school behavior, my work behavior, my school behavior, those are two different things. And we need to help them understand what are acceptable norms under those two categories. And so we use a lot of visually related supports. When I start teaching someone or working with a family in home, we teach the individual to communicate with their family that I need private time, I need alone time, however we're going to use it. These are just but a few examples. And we teach them to put something on their door that indicates this is alone time now, meaning nobody should come in the door. And again, I do not teach bathroom use or masturbation in the bathroom, even when I'm working with a family in the home. For the reasons I have already outlined, there are people who disagree with that. Again, I feel like you need to teach in somebody's living space, in their bedroom. If they're in a group home, same concept, and it's very important. And so I teach using board maker, or we use a very explicit symbol to help them show. And when they're finished, we can use this. I use very specific task analysis for individuals. Sometimes they're actual pictures depicting masturbating. Sometimes they're actual pictures or board maker symbols. I've had people to draw things for me. We've used captioned video. There's a lot of ways to show somebody who may not know how to masturbate safely in an appropriate way. And again, if you have any questions about that, I'm happy to follow up with anybody about this. It needs to be very specific to the individual, it needs to be tasteful, and it needs to be clear in whatever it is we're trying to convey or we're trying to get to that person. Due to the nature of this presentation, I didn't think it was appropriate to show some of the supports that I use, but please know I'm happy to share those or discuss those with any of you. And for any families out there that may be uncomfortable or providers, we need to talk about masturbating when it becomes an issue or somebody is indicating that they're ready for that. Because what will happen is that they may engage in injurious behavior or you'll end up in the dog. A lot of bad things happen, so very important to address that. So I know that was a lot of content in 50 minutes. Now is the time I'm going to go ahead and open it up to questions. If you have anything you want to ask about, if there's anything you're wondering about, or you would like me to be more specific about, please feel free to ask me at this time. Yes, I do have a list, and I'm happy to send that along. I have two different lists depending on age, so I'm happy to send that along to the L Center for them to distribute to you. And the slides I can send either if you want to contact me via email, or I can send that to the L Center. However it makes the most sense, but if you want to email me directly, my email is listed below, and I'm happy to send you. And again, if you have overall questions about anything, and I've touched on a lot of things in a very brief amount of time. Typically, I do this in a even or a full day training. So if there's anything specifically that I went over or I talked about, please feel free to contact me. I'm happy to answer any questions to support whatever it is you may be trying to do, or to work in collaboration with the L Center or whomever you may be affiliated with. Yes, Tim, the online pornography is a huge issue, and we've seen definitely an uptick in the number of people with autism who are being prosecuted by the federal government and the FBI for having images of child pornography. There are federal statutes that in a nutshell, basically say if you are viewing anything depicting a child under the age of 18 in any sexual fashion, you're pretty much going to have a problem. I think it's very important to address adult pornography versus child pornography. I think if you have any concerns about your son or your daughter, a lot of instances where folks are accessing this through shared servers and some alternate things. One specific place that is most often referred to by the FBI and the federal government is called the dark web, or the onion network, meaning you have to link up with some different things. I have worked many cases with young men in specific who downloaded images. Some of them have also a paraphilic diagnosis, or what a forensic psychologist, maybe they're interested in children, and some do not. Some are just curious. This is a huge issue. We need to make sure folks understand what's legal, what's not legal, and to have that conversation with them, and that they understand very specifically. There's a lawyer by the name of Mark Mahoney up in Buffalo, who I've done a lot of work with. He actually has a very good resource on his website. Again, his name is Mark Mahoney. If you want his contact information, I can send it to you. But if you have any concerns about this, you should be talking to, and I feel very strongly that any young men who are using a computer, and young women, need to understand what child pornography is, things you're not allowed to view. I have copies of the statutes. I'm happy to send that along to anyone. And I can tell you, I've had one case in the last 15 years of working these cases, one case where the guy, we kept him out of jail. Every other guy went to jail. Despite having autism, despite not maybe understanding what they were viewing was not something they should be viewing. And the other very important issue here is once you engage in that behavior, you become a registered sex offender for life. And that is a very challenging situation. Thank you for asking about that, Tim. And I'm happy to, there's other specifics about that, please contact me. It's a huge issue. All right, friends. I don't see anybody typing or any more questions, so I'm going to go ahead and sign out. Again, my office number is listed at UCF Card, based out of Orlando, and my cell phone is listed. If you can't reach me there, please feel free to call me, and my email at the center is also listed. If you have any additional questions or I can send along support materials, I'm happy to share anything with you. Thank you for your time today, and thank you for attending to listen to this very important topic. Thanks, and have a great day, everybody.